Hello, 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 everyone. Hi, hello, welcome, welcome. Hi, how are you guys doing? Happy beginning of the weekend to you all. Before we begin, wanted to see, can you guys hear me? Let me know if you see me. I'm looking to see if we start getting comments. But hello, hello, happy end of the day and beginning of your weekend. Hope you're doing very well. So let me see. For some reason, I'm not seeing comments. Let me see if I will see comments. Okay. Oh, hi, Carlene. How are you? Okay, so you can see me. Hey, happy week, end of the week. How are you? Good. Thank you for letting me know that. Um, so I like to always start our live out by asking where everyone is from. I can see you. Thank you, Patrice. How are you? Happy end of the week. Oh, Mama Faye, you're from New York. Great. Sharnetta Gates, blessings to you too as well. Hi. Hello, Sherry. How are you? That's awesome. Well, glad to see all of you guys coming in. Patrice, you're from New Orleans. Okay. I think that there's a convention that I'm going to be going to in a few weeks. We're right next door. Maryland. Okay. And you're from Atlanta. All right. Well, that's cool. You're from Connecticut. Okay. My neighbor here in Houston. Awesome. Tennessee. Okay. Hi, Dr. Michelle. How are you? North Carolina, Ohio. Okay. Hi. Thank you so much, Wendy Lee. Thank you. Thank you for letting me know I'm visible. Well, glad to see, it seems like a lot of us are all over in certain parts of the US. That's great. Oh, I was going to ask, is there any international viewers? But yes, Canada. Hey, Diane, how are you? Okay, all the way from Canada. Awesome. So that's great. I'm glad that you guys are here. Again, thanks for joining in. This is Q&A with Dr. Mercy. I try to come here every Friday, but sometimes I'm not able to. But for the most part, I do try. So April is National Minority Health Month. Hey, Tanya, how are you? You're also from Atlanta. Hi, nice to meet you. And we talked about Canada. Okay. So, like I said, April is Minority Health Month. And so I wanted to use this opportunity to talk about our health as minorities. It's no surprise, it's not a unusual finding to know that, particularly when it comes to minorities, our health is greatly impacted compared to our counterparts. And when I refer to our counterparts, I mean the ones that are not the minorities, the majorities, which are usually those of European descent, as we also call them, white. So the question is, why is that? What is going on, and how can we solve it? And so the purpose of this discussion is just to talk about it. But I also wanted to say, if you have any questions, please jot them down in the comments section. Also, if you have any interesting topics that you want us to discuss, also jot that down as well, because I want to discuss whatever is on your mind when it comes to health. Let's just make this a back and forth dialogue thing. And, so I'm excited. If you have anything that you want to know more about, as long as it can benefit the community, go ahead and jot it down. We can discuss it in one of our future sessions. So let me just dive right into minority health. All right, so what are the facts? Well, the facts are this. The facts are African Americans, African Americans and Hispanic women are more likely to get diagnosed with breast cancer at later stages than white women. And that's just what studies have shown. I did a talk several months ago when it came to breast cancer. And what we found out was that the more aggressive type of breast cancer is more likely in Black women than in white women. And It's mainly a genetics thing, but I'm not surprised that when Black women are diagnosed with breast cancer, it's more in its aggressive later stage because there tends to be that type of highly aggressive breast cancer within the Black community compared to the whites. But it's not only because of the aggressive nature of the type of breast cancer they get, but it's also because we're not doing as much screening as we should. So, just to reiterate, at age 40 or even earlier, if you have family members that have a history of breast cancer, you want to do a mammogram. I mean, a mammogram is simple. It's just an ultrasound of your breast. It takes I don't even think it takes up to 5 minutes. It's just a picture, and they just check to see if there's any spots, abnormal spots there, and they let you know. So, if you haven't gotten your mammogram done and you're beyond the age of 40, just go ahead and get it done. Very simple. It should be an in and out thing, and your body will thank you for that. So, moving forward, African Americans are also 1.4 times as likely to have high blood pressure than whites, and multiple factors in this. One of the more important factor is the fact that we as Blacks, we tend to have the salt sensitive type of high blood pressure. So what does that mean? That means that if we eat too much salt, we tend to have a higher chance of getting high blood pressure compared to our counterparts. And so this also is a plug to watch what you eat, in the American diet. And actually this American Western diet has now kind of spread throughout the world. You tend to see higher dosage of salt. And a lot of it is because these companies use it as preservatives, right? They want to preserve the food so they can have a higher shelf life, so that it can be on the shelves longer. But that salt is now impacting your body and causing diseases like hypertension, particularly in the Black community. So to reduce the amount of salt, you want to stay away as much as you can from processed foods. Canned foods has a lot of salt in it. So you want to stay away from that as much as you can. If you can make your own soup, it would be better if you could make your own stews rather than getting canned. It'd be better. Rather than getting the canned vegetables, get the fresh ones. There's a lot more nutrients in fresh ones because, they're just fresh. So the nutrients that are in the fresh vegetables tend to be still retained compared to if it's canned. It's already been boiled, it's already been preserved. So some of those nutrients have been washed away. So you want to get as fresh as possible. And there is a saying that I saw in one of the conventions that I went to, where a wellness medicine convention. They say, if you can't cook it, don't eat it. If you're buying food that is not, that you look at it and there's no way you could be able to cook that, then it's probably best to at least reduce the amount of that type of food you eat, or don't eat it all. Not judging, but some of the snacks that we eat, some of them we can't cook because they're so processed, too processed. And so if you look at the back of these packages, you'll see, if you don't know the names of them, they're kind of very chemically sounding ingredients. It's probably not really good for your body. So I digress. African Americans are 60% more likely to have stroke. Again, it also is related to high blood pressure. When you have high blood pressure, you have increased chance of stroke, you have increased chance of heart disease, that sort of thing. So not surprising there. We as Black people were twice as likely to have diabetes. Genetics can play into that, food can play into that. And then we as Black people were 20% more likely to report having serious mental distress. And there's multiple factors that are involved in that. Environmental factors, lack of access to medical care can be a reason. And, sometimes we have, mental health can be a stigma. And so we kind of hide it within ourselves. And so I know that lately there has been a public, access and public public PR campaign to saying take care of your mental health. Mental health is very, very, very important. Just as important as your body, it's just as important. So there's ways to help yourself as far as mental health is if you still kind of have um if you still kind of have some doubts of going to see somebody, which I go to see somebody. It's not as scary as it is. It's good to, if you need to let your steam out and let someone kind of help you, kind of see how life is outside of your perspective. It's a good thing. And also, sometimes it's genetics. We may be predisposed to bipolar, depression, anxiety. These are disorders that we have genetic dispositions to, and so environmental factors such as stress, such as other things could bring up those genes and they get activated, and then you have these emotions. So it shouldn't be, having mental disorder shouldn't be a stigma anymore. And then lastly, we as Blacks, we tend to have 2.4 times the infant death rates compared to whites. And that's a problem. So it has to do with lack of access to medical care, and it also has to do with racial bias when we get treatment. So that's another thing that even us within the medical community, we're looking at. How do we make sure that there's no racial biases within healthcare providers when we're treating our patients? So getting to the next slide, so we know the facts, or some of the facts. These are just some of them. There's likely others. What are the whys? Why are there health disparities between the races? Well, like I said, in what I said earlier, there is a lack of access to healthcare. So, I've gone through minority predominant communities, and then I've also gone through communities that aren't minority predominant. And what I've noticed is there's a lot more health care facilities in the non-predominant minority communities than in the minority communities. So facilities is one. And then also in the individual basis, with minorities, there is some percentage of people who, have to do the part-time job or do the jobs that may not pay well and don't provide insurance. And lack of insurance leads to lack of adequate medical care. Time and time again, I see patients that don't have medical insurance, and they come in with very devastating medical conditions. And a lot of times they cannot get the premium care even in the hospital because it is way expensive and they can't afford it. So we oftentimes have to work with them to ensure that they do get care, but it's likely sometimes the alternative care. And that alternative care may or may not be as helpful as the premium care is. So it's always important, if you do can get health insurance, to get health insurance. I know you pay monthly and you may or may not use it, but is the assurance that if you need it, it is there. And otherwise, you have an increased risk from work exposure. So again, those I can speak as coming as immigrant. A lot of times immigrants who are minorities come into this country, they usually can only get jobs that the others don't want to get. So it's, custodian care or, outdoor jobs such as, mowing the lawns or, those type of things, or being in the chemical plants, but not in the higher up position. Maybe exposure to the chemicals. All of these work environments can bring exposures to different toxins that affect your body. And over time, after inhaling it or having contact with these toxins, your body reacts and you have different medical conditions as a result of that. As we talked about before, or genetics plays into the whys. We just can't escape our genes. Our genes are going to tell us, okay, you're predisposed to cancer, you're predisposed to high blood pressure. It's up to us to be like, oh, okay, we see what's going on with our family. How do we prevent ourselves from having that as well? And then, like we talked about, racial biases in treatment. It's not an unknown fact that studies have shown sometimes when it comes to pain, sometimes with us doctors, we don't necessarily acknowledge the pain when it is a minority compared to when it is not. And there has been studies that have been recently published that shows that effect. So the medical community is they're trying to look for ways to make sure that everybody get equal access to pain control, pain relief when they are being treated in the health sector. And then lastly, the whys, lack of knowledge. Lack of knowledge. When you don't have knowledge, you're not going to be in control of your body, in control of your health. And there is a significant lack of knowledge when it comes to medical conditions in all communities, but especially in minority communities. So that also can play a part in why there's a higher chance of more health conditions compared to the counterparts. So we know the facts, we know the whys. Now, how do we solve this? Well, I wrote a list of things. The number one thing is eat more fruits and vegetables, less processed foods, drink adequate amount of water, and exercise more. Okay. That is across the board. It has nothing to do with minorities, but it has everything to do with just general health. You don't need a doctor to prescribe you much things this is like the golden rule. I again recently went to a wellness convention where they were just talking about this. And they said, and I forgot to add one extra thing, and that's sleep more. Sleep is also important too. But this was what they were centering around. And they had studies that showed that those who did this ate more fruits and vegetables, less processed foods, stayed away from meat as possible, drank water, exercised more, and slept better. If they had a health condition, they were able to reduce the amount of medications that they use. And for heart disease, they were able to actually reduce the amount of plaques in their heart, which that's very, 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 very difficult to do, even with medication. So if you don't have medical insurance, you can get medical insurance because of current situation that you're in. Another way to keep yourself healthy and staying away from having to have a disastrous situation is what is written in green. Eating more fruits and vegetables, less processed foods, drinking water, exercising more. And we all know this. We all are aware that this is what keeps us healthy, but putting it into practice is what's the problem. But like I tell my patients, Rome wasn't built in a day. You do the one step at a time, and you may fail one day. Okay, there's always tomorrow. So that's really the nutshell of things. But when it comes to health disparity between the minorities versus the non-minorities, getting routine checkups is really important. You always want to know your baseline health. Okay, so you could get a routine checkup and find you're iron deficient. Okay. And that could be because of a number of things, but it can also be because you just lack iron and you need to eat more foods enriched in diet a diet enriched with iron, or you need to take iron supplements. There's some power in knowing your numbers. And so getting routine checkups once a year at least will help you in terms of your health. And then 2, be aware of your family medical history. That is very, very important. If you know that your dad had a heart attack at age 40, your mom had breast cancer at age 30. Keep that in your mind, because before you're 30 and you're a woman, you should definitely get your mammogram. And your dad having a heart attack at age 40, that's really young. So you'll know that, okay, I should start seeing a heart doctor for age 40, so I won't be so I won't experience what my dad did, and I can start, taking steps so that I don't get a heart attack. A lot of these conditions are there. Yes, a portion of it is because of your genes, but a lot is because of what we do. So if we do things that lead to getting that condition, it will happen. If you have the gene, or even if you don't have the gene, if you do things that lead to it, it will happen. If you do things that lead away from it, there's a likelihood that it won't happen. And then there's just only a small percentage that it'll happen regardless. But majority of the things that people die from, they could have prevented. We're just keeping it, very transparent. Another way we could, when it comes to minority health, we want to strengthen our community. We want to have more community health fairs in local churches, local events, outside local stores. I've done all of these things. I've done them in churches, and you do events such as blood pressure measurements or diabetes check. Those are the two common things that you could do that will help bring awareness of people's numbers, and they can take steps to correct it or manage it. And then also ways to help your community, and leading to that is connect with a local physician or healthcare professional to speak at your events about pertinent and leading medical conditions that may plague the community. High blood pressure being one of it, diabetes being another, obesity being another. There is some worth in just speaking about it in outside of just the healthcare sector, but in the community. So everybody's kind of getting more aware that, okay, let me focus on my health. Because if COVID taught us anything, what it did tell us is that the more healthy you are, the more likelihood, if you have an infection, it won't kill you. When I was in the hospital, a lot of people who died from COVID that I personally had to take care of, they had a lot of health conditions, and a lot of those health conditions were not controlled. So that is an important lesson for us now that we're kind of getting hopefully towards the end of COVID. Now we should look back and say, okay, how do I optimize my health? Taking the vitamins, the necessary vitamins and supplements, vitamin D, important. I've always talked about it. Vitamin C, zinc, important for to fight off viruses. And ideally, if you can take them in foods that are rich in that, that's better. But if not, having them in the pill form like I do here, and I take this every day, that's also as good as well. And then lastly, let's all get involved, monitoring your legislations and policies in regards to minority health, access in both the local, the state, and the national sector of policy would be the best thing for us as a community to do. If you're not at the seat of the table, things will happen that affect you, and nobody's mindful of your shoes, of how you're living, how your community is living, how your ethnic group is living. So let's all start getting involved in just legislation in general. So it doesn't not only has to do with minority health, but anything that has to do beyond the health of yourself. Get involved, because that's where policies are being done in those different sectors. So that's what I have for now about National Minority Health Month. I hope you guys got something out of it. And let me see if there's any questions or comments. Okay. So Claire, you asked about desensitization in the work environment. You just asked for that, but by the way, today to figure out more. Yeah, I mean, there's a lot desensitization in the work environment. There's a lot that can be uncovered when it comes to that. Environment, work environment is definitely comes with so many things, so many factors. When it can be a uh, it can be an origin of stress. It can be an origin of toxins. Uh, it can be there's a lot that you can impact in that. And speaking of environment, just reminded me. Oh, I remember in medical school doing a toxin tour in one of the local cities. They literally put us in a school bus and we drove in the city to look at the different areas of high pollution. And those areas tend to be around chemical plants that were spewing, who knows what into the air. And the focus was not the chemical plant itself, it was the environment surrounding it. So when we saw this chemical plant, like, look, there's a chemical plant, like, and across the street is a school, and across the street is the neighborhood. And guess who was in that neighborhood? I don't think it was the majorities, it was the minorities that were there. And so then they took us to a church. And some of those people that were in that neighborhood that was across the street from the chemical plant came to the church and gave testimony. And they said, on our block, this person got cancer, this person got cancer, this person got cancer, and the list went on. And so, I tell you that to say this. Unfortunately, in this society, there is unfairness, and a lot of the unfairness centers around a number of factors. But when it comes to health and minorities, environmental factors, where you live, can affect your health. And more times than not, areas that are highly polluted tend to have minorities living there. I mean, we just keep it fact. It's not exclusive to the minorities, but tends to be. And so, what does that mean for us? And that means, again, this is the part. This is the part where legislation is at play. Being a part of the seat is at play. Knowing exactly what's going on in the city and advocating for those who cannot be advocated, who cannot advocate for themselves, is also at play. But then also knowing your environment before you move anywhere. Know, okay, what's surrounding me? Where's the nearest plant? Where is the nearest, what's that company over there? Are they spewing anything that I need to be of concern? So having, just not only just saying, oh, this is a nice house, but looking at the radius. Where am I at? Where am I at? Make sure that where you're at is proper for your environment, for you and your family. So that's what I wanted to say. Thank you for reminding me. And so a LinkedIn user said, I believe that some of the genetic aspects are attributed to eating and living in the same manner that our ancestors our predecessors have. No, I also wholeheartedly agree with you with that. We are not as mobile as our ancestors were. We have the cars, the planes, the trains. We're very sedentary. We're sitting, and sitting is just as long. Prolonged sitting is just as dangerous as smoking, as studies have shown. So you're right, but we still want to eat the same caloric type of intake as our predecessors did, as our ancestors did, thinking that we somehow will not gain weight. That has something to do with it. We have to increase the amount of movement that we have. And then again, we also have to talk about our predecessors didn't have some of these processed foods that we now see. I don't know, in the 1800s, Doritos was not there. You know what I'm saying? So, some of these processed foods that we now have, and we have them in abundance, they weren't there back in the day. So that also has something to do with it as well. So the more you eat, you have to make sure you take out. It's balance in with balance out. If I'm going to eat a lot, I'm going to make sure that I expand the energy that I just consumed. Energy in is the same thing you have to do with energy out. It's kind of like a physics thing. So, anyways, good afternoon. Okay, hi, hello from Denver, Colorado. Let me see. Exactly. Unfortunately, yeah, and that, yeah, and yes, yes, I agree with that conversation. I'm not going to say more about that, but I definitely agree. Thank you. You're welcome, Clary. Thank you. Um, And see, so that's another thing too. There's so many factors in that. Whenever I leave the Houston area for a time, my seasonal allergies get better, and so that may be pollution, but that just may be just tree pollen. Plants. There's just a lot of things that can contribute to that. So yeah, their environment makes a difference when it comes to your health. So, anyways, thank you guys so much. Hi, model. Hi, how are you? I'm sorry if I'm pronouncing your names wrong. I'm so sorry. I'm so sorry. But how are you? Thank you for joining us. Thank you guys so much for joining me, and hopefully you guys gained some information. This was a very engaging conversation. If you guys have any other topics that you want to talk about, again, feel free to drop them in the comment section. If it's very interesting, I think I could be able to do a really good segment on it. I'll make sure to do that. If you don't have any more questions, which it doesn't look like, I guess I'll let you guys continue to enjoy your evening. Until next time, bye.